SMSP, Chelsea speaking. How can I help you?
In this office, the phone has been ringing quite a bit lately.
We staffed for the first wave of COVID crisis positions. So when COVID was first hitting the U.S. really hard, like back in March and April, we staffed dozens of nurses.
That was 8 months ago,
So now we're seeing this second wave coming along.
but COVID is still here.
So I oversee the quality administration department. So our goal is that we're onboarding these candidates for their new assignments.
Chelsea Idzior and her employees are putting nurses to work nationwide.
These positions are mainly in the ICU because that's when you're seeing a lot of these COVID patients that are going to the intensive care unit because they're getting really ill.
Health Providers Choice is staffing more ICU nurses now than they have since the start of the pandemic. This list right here shows nearly 50 nurses who are currently active or are being put to work just in the month of November.
But Health Providers Choice CEO Rose Torrento is not just looking out for the well-being of COVID patients, but also for her frontline workers.
One of the things that we as an organization value is our professionals. And we want to make sure their health, their safety, their emotional well-being is what we put first so that they can then be whole enough to care for others.
The HPC staff sends welcome boxes to every newly hired nurse, thanking them for their service and also preparing them for the journey ahead.
It's been an enlightening time for our profession, and I couldn't be prouder of the healthcare providers that we placed in these hospitals nationally.
They serve the nurses so that nurses can serve others. Reporting from Spartan Newsroom, I'm Brianna Idzior.